enemas really have been used for a long time. I mean, they go way, way back. We have reports of Egyptian, Greek, and Roman medicine practices way, way back in the day using enemas. You know, an enema is a way of introducing liquid or medicine through the rectum, your bottom, in order to stimulate a bowel movement, like to empty your bowels, or to provide medication or treat disease, etc. So what am I saying? I'm saying that enemas are not like new, and they are used currently in medicine for the appropriate situation, and they can be done safely. So enemas, yes, as a doctor, we use them in the hospital, we use them sometimes outpatient, etc. Now a coffee enema, well, my friends, that is a different thing, and that's what we're talking about today. I'm talking about coffee enemas, not just regular enemas. So I did a little bit of looking back sort of in some literature just to see, and apparently coffee enemas were apparently used in different wars, I guess, as a form of treatment due to lack of supplies and shortages of medications, etc. There also have been different practitioners throughout history that have, say, used coffee enemas as well. Some of these practitioners have been controversial, I should say. So I want to just tell you that even the concept of a coffee enema, that's what we're talking about today, is not necessarily a new concept, like right now, like it just popped up on the internet today. No, it goes back a little bit too. But the thing about it is coffee enemas are different than the enemas we use in medical practice. You know, like in modern practice, in standard medical care, we might administer an enema before like a diagnostic or surgical procedure for OB, for peds. People have severe constipation. Sometimes people have spinal cord injuries. Sometimes enemas are used in people who have inflammatory bowel disease. You know, they act in a number of ways. They act mechanically, thermally, and chemoosmotically, big word there, to stimulate the intestinal mucosa and peristalsis. So there really is an appropriate and important use in medicine, but coffee enemas concern me. Okay, so the thing about coffee enemas, yes, they sort of function like a regular enema, but they involve inserting an enema into your rectum that's filled with fully brewed coffee. Now, a lot of people who are supporters of coffee enemas say it can do tons of things: boost your immunity, increase your energy, remove toxins from your body, treat a number of conditions, as well as help chronic constipation. The problem with that, and this is the kicker, is that there's not any actual scientific evidence to support these claims. Meaning we don't have data or good data that says that, yeah, coffee enemas, ding, 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 will detox you, boost your immunity, help your immune system, treat all these conditions, et cetera, et cetera. And not only that, and this is probably the thing that worries me the most as a physician, there really can be dangers. Remember your rectum, your bottom, your anus, that sort of area. And the lining of the intestines, they're very thin. They're very sensitive, okay? This is your body, the inside of your body. And potential side effects or adverse reactions can be things like colitis, rectal burns if the coffee is too hot, electrolyte disturbances. This is a big one that I worry about. Problems with regulating your potassium, your sodium. It can cause dehydration, nausea. This could even lead to things like muscle weakness and cardiac arrhythmias and seizures. Please do not sleep on the potential for electrolyte abnormalities when we're talking about colon cleansing, coffee enemas, and things like that. It is a very real concern and a very real potential danger. But there are other potential injuries and problems too, right? You can have problems with hemorrhoids, injury to hemorrhoids. Sometimes your sort of GI tract can literally be disrupted. It can cause cramps, diarrhea, bloating. There's a potential infection risk. And there's also the concern about water intoxication, okay? And by the way, I have plenty of videos on having too much water in our system. You can literally get into major medical problems by drinking too much water. This also could potentially be a source of having too much water. This is the thing. A lot of health influencers out there are saying that coffee enemas will detoxify you. They'll help your gut health. They'll help reduce bloat. They'll help your overall health. They'll boost your immune system, all this stuff. But the truth of the matter is, it's not so simple. And coffee enemas don't do this, okay? We don't have scientific evidence that says they do this. And in fact, there can be dangers. What I would say, and if this is the question that you have next, which I would understand, you're saying, okay, so you're saying that coffee enemas don't do this. Well, what does help us? What does help me? All right, well, let's talk about a few things. Let's talk about the idea of detoxifying, right? So there's a lot of people who believe in cleanses and things like that for detoxifying. Maybe I'll link a video here on cleanses and sort of things like that. We have organs to help us detoxify. Our lungs, our colon, our gut, our kidneys, our liver. So many of our organs actually help us detoxify. Think about it this way. If you actually needed a cleanse or a coffee enema to detoxify, I mean, a lot of us would be in a lot of trouble, right? And that's not the case. Your body does a great job of detoxifying. Now, you say, well, what if I don't detoxify well? Well, that's where your doctor needs to come into play. And likely what we're talking about there is an issue with your lungs, your kidney, your liver, your blah, 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 blah. And that will take us down a whole different path of treatments and things that need to happen. But what needs to happen is not a coffee enema, because that's not going to fix it. In terms of things like gut health, now that's a very sort of vague kind of idea, right? Gut health, what does that mean? Who knows, right? What I would say, though, is let's say you're constipated. Well, that happens to a lot of people. Constipation is something that we can treat, something that eating more fiber, drinking more water can be very helpful for. Getting exercise can be very helpful for constipation. There are great evidence-based FDA-approved medications that help. That we can step up the treatments. Sometimes we may use an enema, not a coffee enema, right? There are other things that we can use. So that's a matter of if it's constipation, I want you to talk to your doctor. The answer is not a coffee enema, okay? What I will also say is, all right, let's say you're like, well, I feel bloated. I just feel like, ugh. Well, this is the thing. I actually want to know when my patients feel like this, because sometimes bloating or bloat can be a non-specific symptom for other conditions that we need to look into. What if you have irritable bowel syndrome? What if you have something else? What I'm saying is that any of these symptoms that you may have deserve proper identification, evaluation, and treatment by your doctor, not looking for the nearest coffee enema. That's what I'm trying to say. This stuff is important enough, okay? So there's plenty of other things. In terms of the immune system and stuff like that, no, coffee enemas don't help with your immune system. You know what does? Exercising, eating a healthy diet, making sure you get enough sleep, minimizing stress, getting properly vaccinated, doing all sorts of stuff. We do have good ways to boost the immune system. It just, honestly, it doesn't always seem that sexy. So I don't think people are always looking for that. But let me tell you, save your money, save potentially your health. I don't believe you need a coffee enema. What I would say is that if this is something that you want to try, look, I'm not your doctor. Talk to your doctor. Ask them questions. Figure out what they think about this stuff. They know you best. But whatever symptoms you have, just make sure you're seeing your doctor for that too. Guys, I'm Dr. Jen Caudle. Follow me on Facebook. Please subscribe to my channel on YouTube. I'm on TikTok, LinkedIn, WhatsApp. Threads, you name it. Follow me everywhere at drjencaudle.com. Also, go to my website, sign up for my free health newsletter, drjencaudle.com. I think I already said that, but said it again. All right, bye.